6, notices of motion. Order number 7, questions and statements.
Now, Honorable Senators, we start with question number 113 by the Honorable Senator for Kisumu County, Professor Tom Ojenda, who I'm informed he is not present today. However, he has delegated the asking of this question to Honorable Beatrice Akinyi, who will ask this question on behalf of the Senator for Kisumu County. Clerk, can you confirm that the CS Labour is in the House? Honorable CS for Labour, welcome to the Senate once again. You're before the Senate for purposes of responding to question number 113 by the Senator for Kisumu County. Honorable Beatrice Akinyi, you may proceed to ask that question on behalf of the Senator for Kisumu County.
Thank you, the Honorable Speaker. As granted by you and requested by Senator Ojenda, this is question number 113 to ask the Cabinet Secretary for Labor and Social Protection. Question 1, could the Cabinet Secretary explain the rationale behind discharging workers in state-owned industries, particularly in strategic sectors such as sugar and textile industries, and how these decisions comply with Articles 41 and 43 of the Constitution on fair labor practices and the right to social and economic security, respectively. Question 2, could the Cabinet Secretary confirm the number of workers affected by the restructuring carried out in Kisumu County, especially in Chemelil, Muhoroni, and Miwani sugar companies, and clarify whether they have received full severance benefits, pensions, and gratuities without undue delay? Question 3, did the ministry conduct socio-economic impact assessments before approving the releases? And if so, table the reports and indicate the mitigation measures for affected households and host counties. Question 4, what immediate program has the ministry introduced to reskill, redeploy, or otherwise safeguard the livelihoods of the affected workers, and how the effectiveness of these programs is being monitored? And lastly, Honorable Speaker, on this question, how does the government intend to reconcile fiscal reforms with its constitutional duty under Article 232 of the Constitution on transparency, accountability, and responsiveness to prevent economic dislocations in counties that rely on state-owned industries? Thank you, Honorable Speaker.
Now, Honorable CS, I note that your response is fairly long. Since the same has been circulated to all Honorable Senators, you may wish to paraphrase it so that we save on time. You may proceed to respond, Honorable CS.
Thank you. Good morning, Mr. Speaker, sir, and honorable members of the Senate. I have a very comprehensive reply, but I'll try to make it, condense it, because there's a lot of repetition in terms of the facts. Let me start by giving a background, because it is important, because it will enable members to understand where we are coming from and also answer many questions asked. Mr. Speaker, the government of Kenya, through the Kenya Sugar Board, the Ministry of Agriculture and Livestock Development, and the National Treasury and Economic Planning initiated a leasing model for state-owned sugar factories as an alternative to full privatization. This strategic decision sought to revive the struggling sugar sector, which has long been central to Kenya's rural economy and food security. Mr. Speaker, under this model, Nzoia, Chemelil, Moroni, and Sony sugar companies were offered to private operators for lease. As you are aware, Mr. Speaker, they had ceased operating properly. The objective was to enhance operational efficiency, modernize production, and restore profitability to ensure long-term sustainability of the industry. The government, this is very important, Mr. Speaker, the government, mindful of the human and social impact of the restructuring, acknowledged that the transition could lead to redundancies among workers. Demonstrating its commitment to fairness, social justice, and compassion, it engaged the Kenya Union Sugar Plantation Workers, which is the recognized representative of employees, and entered into a memorandum of understanding on the 7th of May 2025. The MOU, this MOU between the government and the workers, provided a humane and lawful framework for managing the transition, anchored on the principles of dignity of labor, fair compensation, and industrial harmony. It outlined procedures for the retention, separation, and compensation of workers, and the payment of all accrued benefits in accordance with the law. Let me repeat that. All accrued benefits in accordance with the law, the payment. Key provisions in the MOU include, one, that the person coming in, the lessee, will retain the current workforce up to 12 months under existing terms. So they're not walking in and firing people. For a full year, they retain the workforce. Number two, after 6 months, the lessee is to identify staff for permanent retention and issue them with fresh contracts. Because definitely in any organization, there are people who really will not be adding any value to maybe the new work style, or maybe they have been overtaken by events. Number three, non-retained staff, and this is very important, Mr. Speaker, honorable members, non-retained staff to receive a fair and lawful exit package, including notice or payment in lieu, accrued leave, severance pay as per the collective bargaining agreement, and all salary and benefit arrears. The Ministry of Agriculture and Livestock undertook to settle all salary arrears, pension contribution, and statutory deductions up to the handover date. Payments to be made in a phased schedule up to June 2026, and these have been ongoing very well. Dispute resolution was also clearly provided for through the Transition Committee, where both the workers and also the government, and even resolved through the Ministry of Labour for conciliation. It is important to underscore that the Ministry of Labour was not party to the leasing process. You know, it's a government, not just the Ministry of Labour. Where we come in is to ensure that we safeguard workers' rights, ensuring that all actions comply with Section 40 of the Employment Act, existing CBAs, and the terms of the MOU. Mr. Speaker, let me proceed to question one, now that I've provided a background for understanding. The question is what the rationale behind the process and whether it's covered by law. The ongoing restructuring process in state-owned industries is part of the comprehensive reform programs aimed at restoring efficiency, financial stability, and competitiveness among these corporations. Everybody knows in this country that the sugar industry had collapsed. Cartels had taken over. People had not been paid salaries for years. You know, farmers had cut down their sugar. So this is a government program to revamp the sector and provide economy and money to the pockets of the people of Kenya. The discharge of workers under this restructuring is guided by lawful redundancy procedures as outlined by Section 40 of the Employment Act. It provides safeguards to ensure fairness and transparency for effective workers. Now, part of the process that we have demanded at the Ministry of Labour as per the law is that, one, that the employer must notify the relevant union, its affected employees, and the Ministry of Labour of what they are doing. Has this been going on? Yes, in this case of Mumias. Number 2, provide justification of the scope of the redundancy. Has this been done? Yes. Number 3, pay statutory and contractual entitlements, including notice pay, accrued leave, and severance pay. Same, ongoing. The Kenya Union of Sugar Plantations, the recognized representative of the employers, had initially gone to court before this process where the MOU was agreed upon. The Ministry of Labour and Social Protection has a role to ensure that the redundancy process complies with Article 41 of the Constitution, Section 40 of the Employment Act, and the CBA in force. Mr. Speaker, we have to understand that the ministry does not have the power to approve or reject redundancies, because when anything goes to the private sector or to even the government sector, it is the employer who makes the decision, as long as the employer adheres to the set law. In upholding Article 51 of the Constitution, the ministry ensures fair labor practices are adhered to, and in addition, the ministry ensures that Article 43 is upheld through ensuring that dues owed to employees declared redundant are paid in full. In other words, human rights and rights of workers are upheld. In essence, this process balances economic necessity with human dignity, ensuring no worker is left without lawful compensation. Question number 2, Mr. Speaker, sir. It's asking whether the restructuring carried out in Kisumu County, especially Chemili, Moroni, Mwani companies, and asking about the numbers and their payments. The total employees affected by the restructuring process carried out in Kisumu County is 1,743, broken down in following. 1, Moroni Sugar Company had 747 workers affected, with 312 being permanent and pensionable, 435 being term contract workers. Number 2, Chemelil Sugar Company had 903 workers affected, with 376 being permanent and pensionable, and 527 being long-term or term contract workers. Now, this is quite interesting. Mwani Sugar Company had 93 workers affected, but it should be noted that this was leased or rather sold to, but was not leased but rather sold to Crossley Holdings Limited in July 2025. The company requested all workers to apply for their positions fresh, but only 79 did so, and all the ones that applied were all absorbed. Nobody was fired. The ones who did not want to apply were given their dues and they retired. It is important to note that under the MOU, it was agreed that all employees would receive salary arrears, gratuities, and accrued leave, and several dues paid by the Ministry of Agriculture and the National Kenya Sugar Board in a structured and phased manner. The amounts paid, partial payments of salary arrears amounting to 1.8 billion, have already been made between May and August 2025. The balance, amounting to 3.8 billion, together with terminal bills and third-party deductions amounting to 50 billion, shall be paid in installments up to June 2026. The government is in process, and we don't have any dues that have not been paid as per the agreement. Question C, the third question, Mr. Speaker, sir. Whether we conducted any socio-economic impact assessment before approving the release, and if so, mitigation makers. The ministry did not approve or oversee the leasing process, and therefore did not undertake a socio-economic impact assessment. This was a baby of the National Treasury and the Ministry of Agriculture. Our job is to ensure that any process that is conducted after a decision has been made is in accordance with the Constitution and the law in terms of the rights of workers. The last question, the second last question. What immediate program has the ministry introduced to reskill, redeploy, or otherwise safeguard the livelihoods of the affected workers? In accordance with the MOU, and this was also part of the discussion, all workers will remain in employment for 12 months, where 80% will be absorbed, the 20% nearing retirement, opting out voluntary, will be released with full compensation. Once a final list of retained staff is established, the Ministry of Labour, through the Director of Industrial Training, will collaborate with stakeholders to design and implement reskilling, retraining, and redeployment programs. These will empower affected workers with new skills and enhance employability in related sectors. The last question, Mr. Speaker, sir, how we are going to reconcile fiscal reforms with the constitutional duty of the Constitution for transparency, accountability, and responsiveness to prevent economic dislocation in counties. It is important to note that all decisions that are made in terms of relocating or folding or changing these companies and agencies and parastatals are undertaken by Cabinet, whereby Cabinet is able to sit down and look at the impact of movement of these organizations. As you have noted, Mr. Speaker, sir, the government is not winding down and closing parastatals that have major impact in counties. Actually, what we're doing is reorganizing, merging them to make them stronger so that we can have a government that is able to afford to run itself. I conclude, I submit, Mr. Speaker.
Senator Betty Sakinyi, do you have any supplementary questions?
Honorable Speaker, having listened to the response from the CS, my supplementary question refers to the non-retained staff that at the end of the process are released back to their to the communities. What is the component of this full compensation you refer to? And is there a program that is designed specifically to very disparate? Honorable Speaker, thank you.
Honorable CS, you may proceed to respond.
Thank you, Madam.
Very disparate. Honorable Speaker, thank you.
Honorable CS, you may proceed to respond.
Thank you, Madam Senator. As much as possible, the ones who have not been retained have been the ones who are near the retirement age. But if there are others who do not fit and maybe cannot be held, because you cannot expect a company to just keep somebody and that person is not productive, because then you go back to the same cycle of failed organizations. They are being paid their full pension, they are being paid their salaries, they're actually being paid money to cover up for the amount of time they are supposed to have worked. So, you know, in lieu of their work time. So, for example, if you are released at the age of 40 and you're supposed to work up to the age of 15, you're compensated for the time that you have been let go. So it's basically you're being paid in advance for work that you'll not do. So we had already factored that in part of the agreement to make sure that nobody is let out and then they wallow into poverty. So at times it is unfortunate that some people will get out, get the golden handshake, marry a second and third wife, a fourth wife, buy a big car, or go on holiday, as happens all over the country, and so they squander the money very quickly. One of the processes that we have done is, in terms of reskilling, is allowing some of these people who are out there who would like to come back to NITA and the TVETs to get new skills and get back to work. But they were not set out with nothing. They were let out with enough money to be able to live comfortably. I submit.
Senator Boni.
Thank you, Mr. Speaker. Mr. Speaker, the minister knows that the cabinet sat and made a decision on privatization. However, this was varied to leasing. Minister, since you sit in cabinet, why did you take the initiative to carry out a socio-economic impact assessment? You have now visited our people, families running into millions of Kenyans with challenges that must be addressed by the government. Why didn't you take the initiative?
Senator for Nairobi City County.
Speaker, I used to hear this thing called all-of-government approach. shouted from podiums. I'm surprised that the CS in his response is actually telling us that we directed the questions to the wrong ministry, that we should have looked for the CS for Treasury, who were involved directly. Because he sits in cabinet, I think he should supply some of the answers to the questions that we are raising. CS, you have a responsibility as a government to protect your people, to find employment for them. And those that you found in employment, to try and sustain them in employment for as long as possible, because they are breadwinners for their families. When you allow private entities, such as these lessees, to be the ones to exclusively determine who they need to continue working or not, you are abdicating your responsibility. How is it possible, CS, that the government has no role whatsoever in making those determinations in order to protect its own people? Thank you, Honorable Speaker.
Senator for Tana River County, the Honorable Mungatana.
Thank you, Mr. Speaker. Mr. Speaker, listening to the minister, he gave a figure of 1,743 people affected in these redundancies. And the senator who was asking this question was specific about Chemilil, Muhoroni, and Miwani sugar companies. Mr. Speaker, what this Senate wants to know is whether there was full compliance of Section 40 of the Employment Act. It appears to me that this minister was giving us big figures, 1 billion, whatnot, but he's not telling us whether there was full compliance. In fact, Mr. Speaker, he's saying that there might be future payments. So the first issue is whether there was actual full compliance. The people who are let to go, 1,000, those are a lot of people. How many were actually paid? And Mr. Speaker, just complementary to that, of this minister to get those people reabsorbed into employment. Mr. Speaker, we need to be proactive as a government. You can't let more than 1,000 people unemployed, and then you are not giving. Don't give us figures. Tell us whether you have actually settled those people, because it's there. I thank you, Mr. Speaker.
Senator for Taita Taveta County, Senator Maruma.
Yeah, thank you, Mr. Speaker. Mr. CS would want to know if the employees would be paid before they leave, and how much it would be, or they would be paid after. In fact, the CS should give us a list of how much each will get, because he has indicated that if you are 30 years and you're supposed to work maybe up to 60 years, then you'll be paid for the rest of the time that you're supposed to work. So how much will each person get as severance allowance? Number two, if they're not paid before they leave, we have an instance where medical workers were eased off in 2000. Up to now, they have not received their severance allowance. And some of them have died. Some of them are sickly now. They are quite old. An auntie of mine was working for Ministry of Health. Up to now, they have not been paid. So we want to know how much each would earn, when they would be paid, and in fact, they should enjoy their salaries before they are eased off, or and when they get their lump sum, that is the time when they can be let to go. Thank you, Mr. Speaker.
Senator for Nandi County, the Honorable Chiranke.
Thank you, Mr. Speaker, sir. I'm surprised by the response of the CS Mutua, because Chemelil is part of Nandi County. And from his response, Mr. Speaker, I need clarity. He indicates that only representatives of, Mr. Speaker, if you can indulge me, representatives of Kisumu, Migori, yet Nandi and Kericho, which is part of Chemelil, has not been captured. So can you clarify? And then, Mr. Speaker, we are coming to the tail end of leasing process. What is the fate of unpaid 15 billion and 3 billion consecutively that are supposed to be paid to workers? Are they left to the dogs, Mr. Speaker? Can you clarify on that? I yield.
Senator for Kitui County, the Honorable Kombo.
Thank you, Mr. Speaker. Mr. Speaker, very interesting responses. Interesting because, Mr. Speaker, in the words of the CS, the government clearly has just let workers be dealt with by private investors in determining who continues to work and who has got to go home. But Speaker, most importantly, the question that I have for the CS, after a determination has been made of who is going to leave and who is going to be retained, whose responsibility will it be to pay the gratuities and the benefits and to ensure that those payments, Mr. Speaker, are paid in time? Because there is a gray area there. Who exactly is it that will ensure that these gratuities and the benefits are paid in time to the workers that will have to be let go? I thank you, Mr. Speaker.
Senator Mbugua.
Thank you, Mr. Speaker. I would want the Cabinet Secretary to tell this House the level of involvement of the workers' union in this engagement and also the involvement of the respective county governments, because this is a matter which affects the people in those counties. Thank you, Speaker.
Honorable CS, you may now proceed to respond to those questions.
Thank you, Mr. Speaker, sir, and thank you, members, for those very good questions. It is important to note, going for the first question about non-retained staff and the question about their salaries in the community. Oh no, I answered that one. Sorry, Senator Boni Alwale is asking about the socio-economic study. It was done. When the paper came to cabinet, yes, a study had already been done on the impact of the industry and revival. And the socio-economic study is not just an economic study of when Treasury presented and agriculture, of just the people who are hired and who maybe would lose their jobs or earn their jobs. It was a study of the general impact of the country and of the region. Because you're talking about a sector that was basically crippled. We're talking about reviving a sector, creating wealth, you know, so that majority of people, parents who had given up, farmers who had given up, could now go back to growing sugar and making money. It was going to even inject money into the national, kitty to assist in the development of the country. So yes, there's a lot of thinking that went into it, in how do we revive this? Will it just be business as usual, government pumping money and nothing happening? Or do we need to, think out of the box to revive this one and make it a working system? And as you're aware, citizens and of the areas where they've been affected by where the changes are happening are very happy with the government, because at last, they used to think there was a light, at the end of the tunnel. It's no longer a light, it's a glowing sun, and they're able to reap benefits. There's a question that was asked by a senator from Nairobi about, yes, it's a whole of government approach, definitely. It's important to note this, because I've seen it being repeated severally. It's important to note that, and I think some members may have walked in just after I did my introduction, so they were not aware of this. It's not everyone who is being sent home. According to an agreement between the workers and the government, only 20% is the maximum number of people to be sent home. As I have indicated, even one of the companies that bought one of the factories did not send home anybody. They rehired everybody who wanted to be rehired 100%. So the agreement has been, you come in as an investor, you are only allowed to send home 20%, so that also you can also retain people and also have a chance to employ people who can be of valuable to your work. But then we also say that anybody who is not being retained, and even the ones who are working, continue working, will be paid by the government of Kenya all their redundancies that they have not been paid for many years. Some of them have not been paid for years. They are living on borrowed money. They will be paid all their monies. They will be paid all their dues. The ones who are going away will even be paid for work that they should have been doing, but now they will not be doing because they have been sent out. So that brings me to the third question by Honorable Mungatana, talking about the 1,743 affected. These are the total number of people who are employed, but it's only 80% of them who will be affected, will be retained, and only 20% will be affected, if I have my figures right. Let me look at the statistics. Sorry, yeah. The ones of the Kisumu County, sorry, is 1,743 with a breakdown of the workers that have been there of all the three companies. But the point that we're making is this, is that all of the ones that are being sent home or not being retained, they are all being paid their dues, and they're all being paid in lieu of service as per their contracts. If you're permanent and pensionable, you're being paid for the time that you are supposed to work. If you retire, if you're sent home at the age of 30, you're permanent pensionable, you're compensated for the 25 years that you should have been working to your retirement. If you're on contract, up to the period of your contract. We have ensured that human rights and that workers' rights are followed. This takes me to, I don't have the figures of the number of people who are totally reabsorbed, but I can provide that to Senator Mungatana, with your permission, Senator Speaker. My very good friend, the Senator for Taveta County, asked about the ones who for a long time have not been paid and on leave and on and all this. The payments will be paid on a phased program. It's already been agreed between the workers' union and the government. And the people who are paying is the government of Kenya paying. The government of Kenya has committed, and I gave the figures here, that we have committed, we've already paid 1.8 billion shillings, and this year we are hoping to pay another 3.8 billion. So we are paying everything in installments up to 15 billion shillings. That is our commitment, and the 15 billion shillings will be able to cover up all the costs to pay off all these workers and ensure that they are comfortable. Thank you very much, my good friend Senator Chirangai, from the question about Chimilil. The answers I was giving were specific, but they apply to everything. They are specific to the three Kisumu, the counties, the three companies in Kisumu County. The Senator for Kitui asked about these private investors coming in. And it's important to know that the government of Kenya has midwifed this process. And the union, the Kenya Union of Sugar Plantations, has been the one that has been speaking on behalf of the workers. And they were able to sit down and agree comprehensively that they are happy with the process, and they actually penned an MOU. And I can provide a copy of the MOU, Mr. Speaker, with your permission, so that members can be able to look at it and find that this was an agreed position. I think I have answered any that has yet to be answered. It's because it's been answered. I think I have answered any that has yet to be answered. It's because it's been answered while answering the other questions. I submit, Mr. Speaker.
Yes, we will terminate that engagement at that point. We will, Honorable CS, you may leave at your own pleasure. We will now move to question number 098, 103, and 117. These three questions are directed to the CS in charge of health. Clerk, you may usher in the minister, the CS in charge of health, please. Honorable CS, once again, welcome to the Senate. You are before the Senate for purposes of responding to 3 questions. That is question number 098 by the Senator for Kirinyaga County, question number 103 by the Senator, and question number 117 by the Senator for Kisumu County, the Honorable Professor Tom Ojenda. Question by Senator Daniel Manzo, that is question 033. That question has since been deferred pursuant to a request by the state senator who is not present. So that will not be responded to today. Senator Tabitha, you may proceed to ask your question.
Thank you, Mr. Speaker. Allow me, Mr. Speaker, before I ask my question, just quickly, through our standing orders, that is Standing Order 51C5, to read, and it states, a CS, Cabinet Secretary, shall provide a physical or electronic copy of a response to a question at least 24 hours before appearing before the Senate. I would like really to request that the CS office, CS Health, the CS having been a member of this, not really of this House, but of Parliament, knowing very well that at least we need maximum time to be able to look at the responses so that we can be able to engage from that. So it will be kind to note that your team does deliver the response on time because it has been received this morning. Thank you, Mr. Speaker. As I proceed, my first question, Waziri, was what is the current annual budget?
Senator Tabitha.
Yes.
Are you saying that since the response has been received this morning, you're unable to interrogate that response effectively? Is that your position? Or despite it having been received this morning, you're still comfortable interrogating the response? If that is the case, then you may proceed to...
Thank you, Mr. Speaker. The response has been received this morning at exactly 9:30 as the chamber was starting. Luckily, I've been able to go through the responses, and I'm okay. We can be able to engage. My first question, Waziri, is what is the current annual budget allocation for Linda Mama program and how these funds have been distributed across the 47 counties and public health facilities, including a breakdown of allocations for financial year 2024-2025 to date under SHA, or the Service Health Insurance Fund, that is SHIF. Mr. Speaker, the second question, has the benefit package of Linda Mama changed following his transition under SHIF? And if so, what are the specific changes in coverage, benefit amounts for normal and cesarean deliveries, and eligibility criteria? Number 3, Mr. Speaker, what safeguards are in place to ensure that funds allocated to Linda Mama are used exclusively for maternal and child health services, and that indigent mothers, especially in rural and marginalized areas, receive full benefits without undue delay? And lastly, Mr. Speaker, what steps the ministry has taken to ensure access to Linda Mama services in under-resourced or understaffed health facilities, and how it is addressing barriers faced by mothers in remote and hard-to-reach areas under SHIF structure? Mr. Speaker, I submit my questions.
Honorable CS, you may now proceed to respond.
Thank you, Mr. Speaker and honorable senators. Let me, Mr. Speaker, first apologize and I think it's on my side that going forward I will comply with the standing orders and provide the answers, not even 24 hours, but 48 hours. This I even had to raise with my staff this morning, and it's an oversight. It will never happen again. Honorable Speaker, on the first question, on why, what is the current annual budget, question one, which the senator has said, my answer is this. The Linda Mama program is not currently administered under the Social Health Authority infrastructure. While the program was instrumental in expanding access to free maternal care, it is important that it faced very critical challenges that necessitated a shift to a more comprehensive and sustainable model. And these were all anchored in the 4 laws that were passed by this House. These challenges, Mr. Speaker, included frequent financing constraints, budget cuts, delay reimbursements, significant access and equity gaps, especially for adolescent mothers without identification, and a benefit package that was not comprehensive because it was excluding critical maternal and newborn services like complications and the NICU care. And in response, Mr. Speaker and honorable senators, the Ministry of Health, through the Social Health Authority, has adopted a very comprehensive household coverage model to ensure all vulnerable families can access a broader range of essential health services. And that's why, as part of this strategic framework, the national government, through SHA and the Ministry of Health, is sponsoring 558,000 indigent households, which were identified through the State Department for Social Protection Enhanced Single Registry in order to access healthcare under SHA. And this is ongoing. Governors have come in, members of parliament, and many other philanthropists are coming in to support this program. Furthermore, recognizing teenage pregnancy as a very critical public health challenge in our country, the Social Health Authority has also introduced a very deliberate, targeted intervention for adolescent mothers and their newborns, leveraging digital health platforms and using our community health promoters. SHA now can facilitate real-time registration of these vulnerable groups, ensuring equitable access to subsidized care. And I'm happy to report that to date, 22,000, since SHA came into being, 22,000 teenage mothers across our country have accessed maternal services free of charge. The allocation of funds now operates on a fee-for-service model where funds follow the patient via claims, and this has replaced the previous fixed pre-allocation sort of budget. Question B was on the benefit package of Linda Mama. Honorable Speaker and members, the transition under SHIF has significantly expanded the former Linda Mama benefit package from a very narrow maternal focus to a very comprehensive household coverage model, now known as Linda Jamii Scheme. While delivery services remain very central, reimbursement has improved through a fee-for-service model, and which is aligned with the actual service cost, and this has given us and strengthened inclusivity for all vulnerable households across our country. And the table, Honorable Speaker, that I have provided shows the scope of coverage under Linda Mama and under the new SHIF-SHA program. I really don't want to go. It shows the reimbursement model, the eligibility the scope of coverage, and if I pick on, for example, the scope of coverage, under the, before Linda Mama, this was limited to maternal health, ANC, formal, and C-section delivery at our primary network centers. But under SHIF and SHA, comprehensive household coverage, which include outpatient, inpatient, emergency and surgical care, chronic disease management, maternal and newborn care, including all the complications, is now covered under the Linda Jamii. If you look at the reimbursement model, Honorable Speaker and members, under the Linda Mama, there was a predetermined fixed rate paid by NHIF. There was, the fee for normal delivery was 2,500 for level 2 and 3, and 3,500 for private and faith-based level 2 and 3, and 5,000 for public facilities, and 6,000 for faith-based facilities and private level at level 5 and 6. C-section was Kenya shilling 17. But if you look at the fee-for-service model under SHA, SHIF, the facilities reimbursement is based on the actual service rendered at the approved tariff rate and passed by the House. And then there's standardization of the reimbursement. Now, both faith-based, private, and public, women can have delivery, and SHA will reimburse 10,000. For cesarean section, 30,000 because of equity, whether they go to public hospitals, whether they go to private hospitals, whether they go to faith-based hospital. And then eligibility is different. Under the Linda Mama, eligibility was only targeting pregnant, but adolescents and undocumented mothers were often excluded. But now if you look at the Linda Jamii or the SHA SHIF, under this transition, indigent households are identified via a very proxy mean testing as per the law, as per Section 27 of the Social Health Insurance Act of 2023. So pregnant, adolescents, and newborns are all included through a very targeted intervention using a temporary ID, and the entire household is covered under the SHIF comprehensive. So where the teenage mother can either use her birth certificate, she can use her parent identification, and the system has created a special ID to identify those important section of our mothers who are the teenage mothers. Question 3 about the safeguards. Honorable Speaker and members, several safeguards have been initiated to ensure that the funds are allocated for maternal and child health services, and that vulnerable mothers receive full benefits without undue delays. And what have we done? We have done, number one, we have introduced legal and policy safeguards. The Social Health Insurance Act of 2023, which this House has passed, mandates proxy means testing to ensure that only eligible vulnerable groups are covered, and this is anchored in the use of the funds within Section 27. 2, and more important, digitization and transparency. Reimbursement are processed through digital platforms that validate service for payment. They minimize fraudulent claims. Real-time registration is done through digital health platforms. Our community health promoters help us to instantly enroll to ensure timely access, especially in the most remote part of our country. Then there's equity and beneficiary safeguards. SHA has given priority to the most vulnerable households to ensure that the most, once registered, indigent beneficiaries are entitled to maternal services free at the point of use, without facilities prohibiting from levying additional fees for covered services. And finally, I think the other question was, what has the ministry taken to ensure that access to Linda Mama services in the under-resourced, understaffed health facilities, and how it's addressing those barriers which are faced by our mothers. Honorable Speaker and members, to ensure access to maternal service in under-resourced and or hard-to-reach areas, the Ministry of Health, through the Social Health Authority, has implemented the following measures. Number one, digital registration deployment. SHA has deployed real-time digital registration platforms at all of our over 10,000 contracted health facilities countrywide, both public, private, and faith-based. And this allows pregnant women, including those in remote areas, to be enrolled instantly and granted immediate access to services without the administrative or financial delay. The second one is the community linkage through the community health promoters, who have been empowered to identify, to register, and to link pregnant women, particularly the adolescents and the vulnerable households, to the nearest accredited facility. This strengthens the last mile access, and it will ensure inclusion of mothers to hard-to-reach areas. Lastly, Honorable Speaker and members, we are targeting the under-resourced facilities. And how do we do this? The increased and the standardized fee for service tariff for maternal services is designed in order to create insensitize both for the private and the faith-based facilities in rural areas to remain contracted and sustain quality maternal care. And that's why I am very specific that in some of our most remote rural parts, the faith-based health facilities are available, and that's why we don't want to discriminate. Our mothers can go to either faith-based facility, they can go to private, if the public facilities are not available in that area. And then the last one is to provide evidence of the outcome achieved through the Linda Mama program since inception. Honorable Speaker and members, investing in maternal and child health is a proven strategy for improving the outcomes data from the Kenya Demographic and Health Survey, which demonstrates progress, and it attributes in part to increased access facilitated by the Proceedings program. And reduced maternal mortality. The maternal mortality rate declined from 362 deaths per 100,000 live births in 2014 to 355 deaths per 100,000 live births in 2019. Mr. Speaker, I am very ashamed to say that figure. There are many, many mothers. Kenya should not be at 355 per 100,000, 355 mothers die for every 100,000. Our peers, our regional neighbors are doing better. But the biggest problem I have for now is that even the data is old, is the data of 2014. Now, what we have done at the Ministry of Health, we have decided to do our own in-house data. And we must ask this House and the whole country that it should not be business anymore, that we can talk of maternal mortality rate of this figure. Mothers, when they walk to facilities, they are not patients. When they walk to facilities, they walk to facilities to go and give life. It is immoral, it's unconstitutional, and I think it is not acceptable for us to have this kind of high maternal and child death in our country. And I think at the highest level, from the presidency to the ministry to the houses of parliament to the leadership, all of us stakeholders together, we must discuss this openly. And what we are also trying to do now, that we have digitized our healthcare system. In another 3 months, we will make it mandatory that every health facility in our country, be it private, public, faith-based, they must report maternal deaths. And child deaths on a daily basis through a dashboard. Lower the... But I think going forward, as a ministry, we have a moral duty to do our own in-house every year, every 2 years, both every year, every 2 years, both for the infant mortality and for the maternal mortality rate. Of course, there is improved service utilization. The percentage of women attending at least 4 antenatal care visits in our country has increased from 52% in 2014 to 60% in 2019, indicating improved access. But when I walk around counties to do the SHA rollout, a number of leaders are not agreeing with this figure, and I agree with them, because the data is old. The data is maybe 5 years, 6 years, 7 years. So we need to find out the correct data. And I am ready, willing, Mr. Speaker, I have set up a committee led by the Director of Medical Services, Dr. Amoth, to make sure that we get the right data. How many of our mothers die? We want to make it a mandatory that every health facility reports maternal and child deaths in our country. That is the questions for Honorable Senator Mutinda, Your Excellency. Thank you.
Senator Mutinda, do you have any supplementary?